Washington, D.C., series of conversations with incredible leaders from all over the world who are right on the front lines of this COVID-19 response, and really just trying to bring our community along as we discuss these issues. So thanks for joining us. Thanks for being with us today. Latanya Mapp Frett is with me today. Really honored to have you, Latanya. It's been a while since we've seen each other. You are the relatively new CEO of the Global Fund for Women.
Yes.
You were just telling me how long you've been there.
9 months, so a little more than 9 months now. Yeah.
A little more than 9 months. And the Global Fund for Women has been around for a few decades now. It's your headquarters. 34 years
old. Yeah.
The main goal and focus, as I understand it, but we want to hear a lot more, is funding locally driven women's organizations all over the world, rights groups and others. I think you funded over 5,000 to date.
Yes.
You've got an annual budget around $19 million, and you had an incredible career before this. You were leading Planned Parenthood Global. You've been at UNICEF and at USAID, so you know the space really well. You were even a delegate, I was just reading, at the 1995 Beijing Women's Conference, which has got to be pretty amazing to have seen the trajectory of this movement over that period. So I really want to get a chance to just hear how you're seeing this whole situation, because obviously, when you think of the health workforce, it's mostly women. When you think about people disproportionately affected, I think in terms of deaths, it's men, but in terms of the structural inequalities in a lot of the societies around the world getting hit by this pandemic, it's vulnerable groups, marginalized groups, it's women, it's girls. So we wanted to really hear how you see the situation unfolding and talk about what the Global Fund is doing to address it.
Yeah, no, thanks, Raj. Again, this is hugely helpful to be able to have these reflections right in the middle of it. And, I am at that point in my career where I'm like, oh, I've seen something like this before. So, and I've heard those things before. And I, Global Fund for Women is such a great vantage point for me to be able to work with close to 7,000 women who are either grantee partners, resource partners, or advisors to the work that we do for women and girls around the world. But always we start at home. And so just want to shout out to all the people who have had losses during this COVID-19 pandemic, but also for myself, I have 3 family members in Philadelphia who have been tested positive, 1 in ICU right now. And so they're doing well. 2 of them have actually been given the anti-malarial that we keep hearing so much about, and are responding quite well. And so I'm happy to hear that. And again, having worked in Mali during a lot of the sort of development of the anti-malarial drugs back in, way back when I was with USAID, it's just good to hear that we're sort of looking at what we already have, because there's this push so often, especially with the spin, to try to do something different, to try to get a patent or, some kind of commercialization of a pandemic that I hope we can try to put aside as we try to save lives and to support women during this time. And this is sort of where my head is. And I know you, like I, have been really looking for the data on women. And so, I hear
we had a piece recently on DevX with the number just shocked me. It was an opinion article. We've got this collaboration with UN Women. We're looking at gender data specifically. And a few people wrote a piece on our site that said there's only 6 countries that show gender disaggregated data on coronavirus cases. Which just blew me away. I don't know if that's gotten better or not, but it is symptomatic of a broader challenge. But boy, it's tough to address a pandemic like this. We don't even know that basic information.
And I think in this country, it has the cries for this kind of data has gotten louder as we've seen the marginalization, the increased percentage of deaths among African Americans and Latinx populations. And so we have to keep that rallying call, because I think the tendency is to do that stuff later. I saw that Terry McGovern and others have wrote an article about HIV/AIDS. You remember at the beginning, it was just all, okay, well, this is not a women's disease. This is gay men and gay white men. And, and then, to where we are today, which the only increasing population is
adolescent girls
women between the ages of 15 to 40, right? So when I hear these stories about, well, women aren't as affected or impacted as men, they're, higher rates, men have higher rates, higher deaths, it scares me. It scares me because we're only looking at a very small data set. And it means that the way that women get these diseases is different. We know that. And if we're not looking at that right now, we're really, I think, looking at a future in a couple of years that's going to be very difficult.
Yeah, it's a great point. And there's the disease itself and the direct impact it's having on people, including members of your own family. But then there's all the secondary effects, right? There's the rise in authoritarianism, which lets authoritarian governments maybe clamp down more on women's rights and women's groups. There's the people who are vulnerable anyway, and now might face food security challenges because of the realities of this. And so, we've been reporting on DevEx about immunization rates for children going down because you can't do those campaigns when, everyone has to social distance. So there's so many knock-on effects. And of course, those typically are going to hit the most vulnerable people in society.
Yeah, it's like a magnifying glass on the inequalities and inequities that are built into the systems that we already have. And so many of the issues that we have to work on every day at Global Fund for Women are now just being, super magnified. We have partners who are already having lines, so domestic abuse lines, rape lines, that they're seeing increases between 30 and 50% right now, which is just for an already bad problem makes it worse. And when you think about
that should be obvious to people listening, but just to underline it, it's part of the problem is when you're social distancing, women might be forced to stay with a violent partner. They might not feel like they have another option. But maybe you want to just talk through that gender-based violence issue a little bit.
Yeah, no, and I know that the UN Secretary General has put a spotlight on this, which the shadow of the pandemic, which I totally applaud. Because social distancing is such a Western concept in many ways. And so if you're forced to be in the house with partners where you are already not safe, now you don't have the opportunities. Many of our partners have opened up what they call safe houses. So in an ordinary circumstance, you might be able to leave your house to distance yourself from your violent partner. And in this situation, and especially in countries where they're clamping down in what I might call a militaristic way, and so you can't be outside unless you have permission, women just don't have anywhere to go. And so that violence is increasing at 50-fold, 100-fold in some places. I've talked to my colleagues in South Africa, Kenya, and Nigeria, where I've spent a lot of time in my career in those three countries, but also in Iraq and in Hong Kong and Taiwan, and where we've seen, even in Wuhan, we saw this domestic violence increase during the time of the stay in place. And so we have to be very careful that we have options for people who are not as privileged as we are in this country, for sure, to be able to seek out that kind of assistance. And these community-based organizations run by women are really the only place where you can trust that these programs will be able to continue and new ones can start for those that are particularly hard hit during this pandemic.
The last time you and I saw each other was at Women Deliver, that conference in Vancouver. It feels like it was years ago. It wasn't that long ago, but these weeks feel like years now in the middle of this. But I remember one of the big themes was how, especially women's rights groups, are really underappreciated, underfunded. And there's a lot more interest and attention, maybe for good sort of political reasons, on funding more technocratic solutions on things that are a little more politically palatable. And the issue of rights often goes by the wayside a little bit in the international community. And I wonder what you're feeling and hearing now when there's so much attention on the COVID response, for good reason. International organizations are flooding in, foundations and others. Are you feeling that maybe funding for women's groups is going to go down because of this? Are people kind of, do they get the interconnectedness of this? You talked about the community-based groups that are really essential to this response. How do you see that developing?
So the women that are on the ground, the women that are doing this work, and that's both here and around the world, get it. They've been here before. Again, it's, we are not going to trust that if we sort of put the issue of human rights to the side, that we'll get to the finish line, because we've seen that doesn't happen. And so a lot of what I feel right now is just pride of the women's groups who are coming in, and I'll talk about the funding because we have a particular crisis fund. And so we're receiving, as you can imagine right now, an enormous amount of requests from women's groups to be able to support initiatives that will either prepare or respond to this pandemic. And they have been things that are just, like oh, wash your hands, which is very simple, everyone says, but if you don't have access to water in many communities, that's not such a big thing. And so women are coming up with ideas to do that. But more importantly, getting out the right information, Raj. As you know, it has been hard for us here in the US with the spin to understand what's exactly happening, what it exactly means for us, what we should or shouldn't do. And just imagine when you compound that with language, with literacy, all of those things. And a lot of these women group, what they're trying to do is reach their communities in the right language, with the right context, with the right cultural comments. I mean, social distancing in some places, as you can imagine, is just not even a concept that you could explain in some languages. And so a lot of what these women's groups are doing is trying to get that information out, trying to explain it in a way that people understand. And so, with the governments that are clamping down, being especially hard on marginalized groups, in some countries, we've heard that people are blaming, queer or LGBTI communities for this pandemic, and, just crazy things. And so we see that, women's groups are standing up. They're doing a lot more digital advocacy than they have in the past, and really trying to respond and hold their leaders accountable. And so that's what needs to be continued to be funded. And I know we need a we need a vaccine. We need all kind of, cures that can help us get through this and flatten the curve. But at the same time, we have to fund those organizations that are right there on the ground, which are going to be the answer to whatever result we come up with. And so I am hugely encouraging organizations not to start new things, but to fund those groups who are already on the ground, to fund women, particularly women and girls groups who are having to do this work. They're actually having to pivot from the work that they've been doing in order to respond, and they do it because they have to.
Yeah, there's been a long standing idea in the development community. People like yourself who've worked across many organizations know this well. The idea that we've got to get more money to domestic indigenous national groups, to local organizations, right? And there have been big pushes to do it, USAID, at other major development funders, and yet it's been very hard to do. And one of the things I'm hearing from other leaders is that maybe this is going to be the moment where we actually do it, because we're actually forced to do it. We literally can't send expats on airplanes. We can't just hire international organizations headquartered in places like here in Washington, D.C. We've got to use organizations that are really rooted locally and have the local context and are there and are in the communities. I wonder how you see that developing. Is this a real moment to shift the whole way we think about the development project to something which really is more locally rooted?
Yeah, and I mean, Raj, that's an excellent point. And I've been thinking about it a lot as well. And I mean, 25 years in this career of trying to move us, I think it's a success story in some way that we've been moving in this direction for some time now, right? So we've been trying to fix international development so that it's not so West focused, that the power is not just sitting with those that have the resources, and thinking that the recipient is supposed to just, take some, strategy that was created in Washington, D.C. or in the UK, in London. So what we see now is that there are these opportunities to be more directly focused on local organizations, but with that comes what I call a feminist funding principle. You can't just assume that you can say, hey, here's $100 and I'm gonna tell you exactly what to buy with that $100. You have to trust the organizations that you work with. And if you don't trust organizations directly, work with those that know those organizations, like Global Fund for Women. Because what it means is that they need flexible funding right now. Just imagine whatever USA project they've been working on, let's just say in maternal health. This COVID has changed everything, where we were moving women into hospitals and health settings in order to deliver. Right now, what are they doing, right? Many of them are going to have to deliver from home. And how does the health system respond? And then how does organizations on the ground use that funding in order to do that? And so we have to be flexible with our funding. We have to understand that they need core support. That means they need to be able to pay people. And many of as you remember, as this started going local, they got stricter and stricter on how you could use that money. It's like, oh, we're not going to pay this, we're not going to pay over that. But they need to be able to build their organizations around staff. The people are everything, right? And so we have to think about that as we're thinking about how we work better with local organizations. And, and from our perspective, not just my Global Fund for Women, but we have a host of sister funds around the world who are working nationally or regionally, who are doing this same kind of work, which is encouraging the funding community to trust women, trust their organizations, fund them in ways that they know how to respond to things like a COVID-19 pandemic. And so for me, I'm proud to be in this space right now because that's exactly what we do. When they call us and they're like, hey, we're going to pivot from doing this particular campaign, our advocacy campaign around abortion rights, we're going to have to move into a space where we actually use some of that money to get information out and to deliver services to women that are being particularly affected right now. We're like, hey, of course, you've got to do that. Let's do that. And I think a lot of organizations are thinking hard about how they reach local organizations, but they should also think one step further with this, how that they can be a good partner to those local
And
organizations.
how do you judge other funders and how they're doing this so far? I mean, your organization is a funder, but you're also a recipient of grants that you then, on grant to these local and smaller organizations. You know the international system really well. You look at the private foundations, the USAIDs, the DFIDs, et cetera. How do you judge how they're doing so far in this pandemic response? Are they using that feminist lens? Are they, being flexible with funding? Are they supporting local groups the way they should be supported? What's your feeling about it so far?
I've seen some really good family foundations, of the world, trying hard to respond in what I might call with the feminist lens. And so I think it's a little easier for them. Those that are a little bit larger and or governments with huge bureaucracies behind them that are actually not functioning well right now because of the pandemic and the stay in place, I think it's been harder for them. And that's because the muscle on which they fund these things. So it is very directive. It is very much working with organizations that fit a particular idea of what a local organization could look like. It's certainly not the ones that we fund, right? It's not the
Let's talk about that. Yeah, what do you
right?
mean? What is that mindset difference there? What do you mean?
So there are, so I've lived in more than 15 countries over my career now. And so there are going to be those larger national organizations and countries that are doing well. Sometimes, but not all the times, they're propped up by positions of power. So you might find that there is a NGO that's been started by the first lady or a former first lady which is doing very well, which attracts, all of the bilaterals and many of the larger foundations. But at her side or at that organization side is those community organizations that have, started years ago by the sweat and blood of the women, probably because of some violation that was happening in the community that a woman just had to say, we've got to do something about that. But the way that she's been funded to build her organization around her without the same kind of resources, it usually doesn't attract the bilaterals. It usually doesn't get to the attention of the major funders. And so that puts her at a disadvantage to this other larger local organization who does get all of those funds. And so when you go in country, you find like 4 organizations that everybody is funding. And what I love about Global Fund for Women, and the reason I came here, is because the rest of us, the rest of the community that needs that funding and does not have the opportunity to have 20, great staff members that have been educated all over the world, but who are living in the space right now and doing the work, again, with their sweat and their blood to make things right for their community and to develop in a way that catches up even with their own country's agendas.
Yeah, that's a big part of the value proposition, I think, of Global Fund for Women and other groups like yours, which is bigger donors can fund money to you, and then you do the vetting and you find the right local groups that really do have that local knowledge and respect in their community and do have their sleeves rolled up, right? And that's not easy for lots of other funders to just go and do by themselves.
No, it's true. Right now, we're hearing from a lot of human rights defenders, so women who have been jailed or, jailed, but who have been forced to stay at home in many different countries around the world. We've been always sort of advocating for this, but right now it's particularly difficult because in the prisons, as you know, incarcerated people right now are experiencing a real challenge trying to get at that. The women who are in jail just for speaking up, we're asking governments to please look at their prison populations and let people go who've just been sitting and wasting away waiting for a court date, particularly women who are human rights defenders. And for us, this is a crisis right now. And as you
It could
said,
be a
it's
death
not just a
sentence,
health
right? I mean,
crisis.
right?
Right.
You've been
Exactly.
sentenced to a short jail sentence. This could be a death sentence if you can't get medical care and you get the virus inside of prison.
Absolutely. And it's happening. It's happening as we speak. And so we're really trying to encourage governments to really take a look at this and to let these women out of jail who have, and most of the time it's past administrations. It's not even current administrations that they spoke out against. It's time to let these women and other people out of jail who we know are not there for violent crimes. And so we've been talking about that, but that's the kind of things that these women, I mean, it's not me, it's women around the world who are like calling in and saying, hey, we've got to look at this. And so that's what I love. It's like, we have to pay attention, yes, to the pandemic itself and to the health and economic ramifications, but we also have to look at where there are these little niches that are happening around the world that we wouldn't know about except for those women on the ground and their families and their communities telling us what it is. So
Yeah, I mean, it's hard to predict how this whole thing is going to roll out, but I'm just curious to get your take on it. Given all your experience, the epidemiologists who I've been talking to in these conversations say, maybe things are going to get better in the US and in Europe because of the social distancing measures and the stay-at-home orders, but it's going to get much worse in the global South in the coming months. You're going to see peaks there in a lot of countries in the global South where the systems aren't as strong, whereas you said it's a lot harder to social distance. People have to leave their house to get food every day or to work to get an income. How do you see this playing out in a lot of these countries that you have experience in?
So, well, Raj, I'm an optimist. So I hear all these sort of doomsday, and I even heard our colleague Melinda Gates talk about people dead in the streets in Africa. Listen, I'm kind of impressed with sort of the preparation. I mean, of course, there's a lot of countries that have not now taken measures, but a lot have. And they're trying to stem this. They're trying to use the best guidance that they're getting from WHO and from other entities to try to prepare so that they don't have to face this crisis in their health systems. We all know they're weak. They know that they're weak. They know it because they've had so many things before this, right? And so I believe that my hope is that right now we are going to find a vaccine or some sort of drug that will help stem the disease, but that will focus also on the underlying conditions, which of course are the problem, right? I mean, there's few people who are actually dying from COVID-19. What people are dying from are those underlying conditions that they already have. And so in systems and countries that we've lived in and we know of, where you've already been trying to strengthen your health system to address these conditions, that we have to keep moving in that direction, because it's those conditions that are actually having people die. And so I do believe that the number of cases of COVID-19 will go up. My hope, though, is that our focus on the underlying conditions will help us create an environment where the death and the percentages of deaths either stay flat or go down. And I do hope that that will happen in the countries. And like I said, it's an information. You got to get information out to people who are experiencing those conditions and how to take care of themselves and what to do when they have emergencies. So I agree with all of what we're hearing from the epidemiologists, that we're going to have a growing cases of COVID-19 over the next months and probably years. But that the ability to be able to help people and to prevent so many deaths will have increased also. So that is my hope.
Yeah, you're making me think of a conversation I just had a couple of days ago with a South African doctor who leads a major global health technology company, social enterprise that provides tech to governments to deal with health issues. And he was saying the worst thing we could do in this scenario is to fund the COVID-19 response as a vertical program. That we've got to think, about the health system itself holistically. And the example that comes to mind for me is the West African Ebola crisis just 5 or 6 years ago, where I think 11,000 people died tragically from Ebola itself, but many multiples of that died from everything else, malaria cases for kids who couldn't get to a hospital because of Ebola. And it's a little bit different than the case in an advanced economy like here, where we have a much more robust health system. In a lot of the countries where you work, I could imagine that more people are going to be affected by everything besides COVID-19 if we don't get this right, to your
Yeah.
point, if we don't think about all of those underlying conditions and the whole system.
Yep. And Ebola was a great example. I mean, in many of those countries, I mean, you remember Nigeria actually did really well. I mean, comparatively, right? Because they were addressing those issues in their healthcare system at the same time that they were trying to address Ebola. And so the number of deaths they saw were low. And so my hope is that that will be something that we'll see in many countries replicated, because we have the experience, right, of a Nigeria and some others, you know, who were
And
able
yeah,
to stem it, right?
and in
Yeah.
Nigeria's case, they had the benefit of that polio eradication program, and they were using the same system for contact tracing and for
Right.
delivery and supply chain. And so they benefited from that. And a lot of the experts I'm talking to on the ground in Africa are saying similar things, that you've got experience because of the HIV crisis
Yeah.
to do contact tracing. You understand much better how to educate populations around health issues. So in some ways there are advantages, while in other areas, certainly like medical technology, ICU beds, and all the rest, there are huge disadvantages.
That's right. And I'll go back to my call that we know that our leaders around the world are focused on this for the health system, and I, you know, the support we need to give to them. And I think a lot of the large major bilaterals as well as large foundations are doing that. But I also want to just emphasize all that happens while these things are going on, and the violations of human rights, the further marginalization of people from particular groups, are something that we have to keep our eye on, and we have to support groups that are doing that in the country. And so while I'm fairly optimistic about COVID-19 and our ability to get through this, I'm less optimistic when it comes to us paying attention to what's happening on the periphery, and how we support communities to be able to handle this where there are no privilege. I mean, education is such a good example. I mean, here in our country and in many other countries in the West, it's you know, okay, our kids are not in school. They're going to have to do some sort of distance learning. The school districts are, you know, mobilizing to make that happen. I mean, but, you know, to be honest, in many of the countries where I live, there's no school. There's no school. And so girls are going to miss whole years of school, you know, a whole year, quite frankly, if you think about the way that their systems are working. And in the protection that being in those schools provide them, quite frankly, Raj, is something that I think about. We have to understand that the circumstances are very different in that case. And education is becoming the great equalizer, right? So, you know, you have as many, if not more, girls in school at different parts of their lifetimes. And if we look at a year of this where they will miss school, that equalization now starts to fall apart. And so I am worried about those things that
you can have really
I will
long-term
miss.
effects, right?
Yeah.
A year out of school can have really long-term effects, especially if you're right there at the edge. If you're living in a marginal situation, as it is anyway,
Which
it
many
can
are,
be,
many
which many
more
are.
than should be, that's for sure. Yeah. So those are the things that I think we have to keep our eye on the ball with as members of this, of the development community. I think it's going to be hugely important. And I think people are, I just, I just want us to not forget it. So we do have to deal with the pandemic. We do have to make sure that we're able to support the systems, the structures, get a vaccine, get medication out to people. But I think as important, we have to make sure that we don't fall back in the areas around human rights and advocacy that we have over the last 20, 30 years.
Let me just ask you before I let you go, what this is going to mean for the Global Fund for Women. You talked about you're setting up a special fund. You've been there 9 months. This is going to be with us for a long time if we listen to a lot of the epidemiologists. So how do you think it's going to shape the work you do at Global Fund for Women in the coming months and years?
Yeah. And, and I just want to correct one thing. We didn't set up a new fund for COVID-19. What we did was we took our crisis fund. The crisis fund is to address, every year, I would say things are happening. I think the big last time that the organization really had to roll out its crisis fund was around Syria. the conflict there. But there's natural disasters that we're addressing in certain communities around the world all the time. And of course, COVID-19 is the most current. And I encourage people not to set up new funds. I encourage people to work within the structures that they already have. In so many different organizations, even corporates are like scrambling to see who they can fund. And it's like, let's not set up new mechanisms right now. It's not the time. Let's address those organizations that are already doing good work and are desperate to get funds to do the work around COVID-19. And so we feel like that is the trusted relationships are important. The flexibility around funding are hugely important. We are seeing organizations that are just doing amazing, innovative type of things. I talked to a colleague in Iraq and the way that she's working with her community, and of course, trying to, as we were talking about distance learning, trying to set them up so that they're not missing whole years of school. These things are happening. We're getting these calls and emails all the time about the work that we can do. I want us to be in a position to help every single person that calls us. And so what I'm asking of other funders and what I'm asking of our country and other countries is to make sure we're there as partners in this world to be able to support those efforts that are happening in ways that we can't even think of, but in ways that we're privileged to be able to be home, to be safe, to be able to have our kids continue to get education, thinking about those that can't. So that's where my head is right now. For us, this crisis fund that we have represents that. And just one more other thing that I'd mention is I know this is a time where we can do like endless TV watching, and things like that. And a lot of us are having like guilty pleasures, but I would also encourage us to get to know what's happening in the world. And this seems to me to be an opportunity. I know we have a film series running called fundamental.com. I think it's fundamental-film.com. You can go to, or just go to globalfundforwomen.org site and it will link you to it. But it's like these films about women, they're shorts. And so they're like 15 minutes long, but it's about women in different countries who are like ending child marriage in Pakistan, who are tackling human rights around LGBTI communities in Georgia, the country. But also we have one in the US, which is dealing with intersectionality and how you live it, not just a buzzword, but how you deal with all the issues that are happening in Black and immigrant communities in particular parts of this country. So I'm very hopeful that people who are listening to me like, well, why is that happening in Nigeria or another place, will take an opportunity to really kind of get themselves educated around what's happening in other parts of the world while we're in place.
Well, we'll put the links to those documentaries right in the description here, and I'm looking forward to watching this.
Thank you. You'll love them.
Yeah, you talked about holding up a magnifying lens to these issues, and you've certainly done that in this conversation. And you do that every day at Global Fund. So thank you for all the work you're doing. So good to see you, and thank you for taking some time to share those thoughts with us today.
Great to see you, and thanks for the opportunity, and all the best to Maria Teresa and the family. It's just great to be able to see what you're doing and how you're growing DevX. It's important. Thank you.
Really appreciate that. Yeah, and all the best to you and your family.
Okay.
Good to talk to you.
Take care. Good to talk to you.